Euthanasia. Terri and I will be discussing the details about euthanasia.
To intentionally end a person's life painlessly. Euthanasia comes from the Greek term for good death.
There are two types of euthanasia. Voluntary euthanasia, which means the act of ending the person's life with their consent and their will to end their suffering. The other type is involuntary euthanasia. Involuntary euthanasia is performed without the person's consent, but decided by the parent, guardian, or caregiver of that person. Involuntary euthanasia is usually performed when the patient is unable to make a decision on their own behalf.
Procedural forms of euthanasia. Passive. Passive euthanasia is when all life-sustaining measures and any and all treatments are ended, resulting in death. For example, turning off a respirator, failure to resuscitate, no longer administering medications, and discontinuation of food and water, resulting in starvation and dehydration. Active. Active euthanasia is when a lethal substance or force is used to end a patient's life, either by them or someone else. Self-administered prescribed medication, or a doctor and or nurse practitioner injecting a lethal dose of a medication. Why choose euthanasia? Terminal illnesses like cancer or ALS, life-limiting physical disabilities, reliant on a respirator, prevent a prolonged and painful death, control the circumstances of your death, when, how, where. You would like to die at home in the comfort of your bed. You don't want to die in the hospital. You don't want to suffer endlessly. Failure to resuscitate as per a person's living will. In an irreversible coma, or brain dead and reliant on machines to live, therefore ending life-saving care. Euthanasia in Canada. Euthanasia was first legalized in Quebec in 2014, then nationally in June 2016. Voluntary euthanasia, now known as clinical assisted medical assistance in dying, in Canada is when a physician or nurse practitioner directly administer a lethal substance resulting in death. Self-administered medical assistance in dying is when a person is prescribed a drug they take themselves and results in the end of their life. These are the two options available to Canadians. In order to be eligible for medical assisted death in Canada, you must meet all of the following criteria. Must be eligible for federal or provincial funded health care. Visitors to Canada are not permitted. You must be at least 18 years old, mentally sound, and able to make medical decisions for yourself. You must have a serious and incurable illness, disease, or disability. Make a voluntary request for medical assistance in dying that is not the result of outside pressures or influence. Give informed consent to obtain medical assistance in dying. Slippery slope? An opposing view. Many who oppose euthanasia feel it gives doctors too much power and may make those in vulnerable situations see this as their only option as they face pressures from family members or overcrowded medical facilities. talking about a slippery slope. Hitler and Nazi Germany sanctioned the death of many mentally ill and physically disabled adults and children in what was known as the T4 or Euthanasia program. This was done to rid Germany of those who were less than perfect so the Nazis could create their master race. The Nazi T4 or Euthanasia program was done without family or patient consent. The children were taken to facilities and given a lethal dose of drugs or starved to death. The adults were sent to various T4 facilities throughout Germany and were killed in the gas chambers. The causes and dates of death were falsified as to not raise suspicion with the families. Voluntary euthanasia is the start of a slippery slope that leads to involuntary euthanasia and the killing of people who are thought to be undesirable. I would say this is a prime example of that statement with what Hitler and his soldiers did. Morally unethical? Religious opponents disagree with euthanasia because they believe the right to decide when a person dies belongs to God. A hopeless case. Under current Canadian law, medically assisted death by doctor is not an option for Canadians suffering from mental illness. The current legislation only allows consenting adults, 18 years or older, with an advanced terminal incurable illness where death is imminent to benefit from a medically assisted death. But thanks to the efforts made by 27-year-old Windsor man, Adam Mayer Clayton, and the continuing support of his family, this is under review. The hope is that people who are mentally ill, suffering from dementia and other competence-eroding conditions, as well as mature minors, be allowed to choose a medical-assisted death by doctor. This review is expected to be completed by December 2018. Many mental health activists are against this option for the mentally ill, as they feel most conditions can be treated with medication and appropriate care. This was not the case for Adam, and sadly is not the case for many. Adam, who suffered depression, anxiety, and a psychiatric condition called somatic symptom disorder, was in a great deal of pain. He tried a number of medications to help relieve his symptoms, which included nausea, headaches, burning sensations, and other unexplainable pains, but these medications did not make a difference. But again, by current Canadian standards, because he was not in a position of imminent death, he was technically not eligible for medical assisted death. No longer able to take the pain and not eligible for the death by doctor, Adam decided to take his life by suicide on Thursday, April 13th, 2017. That's the fact. Some people aren't going to get better. We don't have treatments for them. It's pain you can't see, but it's pain nonetheless. Adam Mayer Clayton. Dying with dignity or murder? Let's talk about it. Many people feel very strongly about this topic and are on one side of the fence or the other. Do you feel it is a basic right of life to choose how we get to die, especially when we are suffering? Is it right for someone to make this choice for you when you can't, or is it murder? Should parents be able to make this decision for their severely disabled children who cannot make the decision for themselves? Should minors be able to make this decision if they feel their quality of life is less than what they expect? Should mentally ill patients be able to make the choice? Let's talk about it on the Padlet. Interesting historical overview of euthanasia around the world, please visit the link below. It's pretty fascinating to see how views have changed over the course of history. Thought. My aim in helping the patient was not to cause death. My aim was to end suffering. It's got to be decriminalized. Dr. Jack Kevorkian. Thank you.